Good evening. The World Health Organization has declared the coronavirus outbreak in China a global health emergency. At least 170 people have now died and almost 8,000 have been infected. In the next hour, a chartered flight will evacuate 150 Britons from Wuhan, the city at the centre of the outbreak. They'll land back in the UK tomorrow morning and will be taken straight to an NHS site in northwest England and kept in isolation there for 14 days. China has now effectively quarantined more than 50 million people in Wuhan and its surrounding province. The virus has now spread to every region in China. Cases of the virus have now been confirmed in 19 other countries, including Australia, America, Japan, India, as well as Germany and France. And tonight, Italy has confirmed its first 2 cases. So far, there have been no confirmed cases in the UK. From Beijing, John Sudworth reports.
Wuhan's medics are locked in a daily battle against this epidemic, with infections still rising steeply. But for trapped British residents, at last a way out.
Yeah, it's a massive relief. Can't wait to get back now and just sort of get away from everything and de-stress, I think.
From the rendezvous point at a motorway toll booth, those travelling face multiple health screenings, a bus ride to the airport, then a wait for the flight. But for some, there's been serious confusion, especially mixed nationality families like Adam Bridgman, his Chinese wife Sue and their newborn son Austin, with the UK authorities unable to say if they can get on the flight.
They couldn't tell me whether or not my wife or my son would be allowed on the plane. They said that's a matter for the Chinese authorities, and the Chinese authorities would decide on a case-by-case basis.
So that leaves you still stranded in Wuhan. What does it mean for the baby?
The main worry is medical care. If he gets sick, then we're in trouble.
We've heard from at least one other family in a similar predicament, unable to board the plane. But the confusion seems odd. After we sent our own questions to the Chinese Foreign Ministry, we received this fax saying that Chinese nationals would be able to accompany their British family members on the flight. We've passed the information on to the UK authorities. In Wuhan, 2 large, brand new hospitals are being built in little more than a week. But existing hospitals are publishing desperate appeals for medical supplies. And fear is spreading. This unverified video shows a family from Wuhan living elsewhere in China, having their door sealed shut. Remarkably, some criticism of the authorities is being allowed to go uncensored. This doctor lambasts what he calls communists who love to shout out slogans.
I'm Natalie and this is Jamie.
Natalie Francis is British, but her son has a Chinese passport. Shortly after we received our fax, they got a call from UK officials.
They called us about 20 minutes ago and said that there's a good guarantee that they will allow Jamie on the plane.
In a chaotic race to get out, relief for those who make it, further anguish and uncertainty for those who don't. Sophie, as well as the 150 Britons, we're told there's space on board for 50 people from other European countries. It's due to take off in the next hour or so, and when it does, there will undoubtedly be a huge sense of relief. But for those left behind, they find themselves in a city in the grip of an escalating crisis, an increasing number of infections and an increasing number of deaths. And they have no choice but to batten down the hatches and stay indoors to stay safe for as long as it takes.
John Sudworth in Beijing, thank you. Well, here the risk level has been raised from low to moderate by the UK's chief medical officers after the World Health Organization declared the coronavirus outbreak a global public health emergency. Here's our medical correspondent Fergus Walsh.
It takes just one international flight to carry the China coronavirus around the world. That's why airports like this one in Dakar's Senegal are attempting to screen passengers. It's the fear of what the virus could do in poorer countries that's prompted the World Health Organization to act.
The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems.
The World Health Organization defines a public health emergency of international concern as an extraordinary event which requires a coordinated international response. In the past 20 years, it's been declared 5 times for the swine flu pandemic, polio, 2 Ebola outbreaks and the Zika virus. This allows the WHO to make recommendations on how to control the global spread of the virus related to travel, such as screening at airports, boost resources for containing the virus and spending on research into treatments and vaccines. BBC News was given access to these labs in San Diego, California, where scientists are racing to develop a vaccine to protect people from infection. Usually that process takes years, but that could be reduced to just months, according to a British scientist, after China shared the genetic code of the virus.
We received the sequence from the Chinese government and we worked overnight, and the next day we had designed a vaccine. We immediately put that vaccine into manufacture, which is the stage that it's currently in, and we hope that that will be entering into human clinical trials by early summer. That timeline is absolutely unprecedented in vaccine development.
In the UK, the repatriation flight will land at RAF Brize Norton in Oxfordshire tomorrow morning. Then, the British nationals will be driven 170 miles by coach to Arrow Park Hospital on the Wirral, where they'll spend the next 14 days in quarantine, housed in former staff accommodation blocks. Fergus Walsh, BBC News.
Well, our health correspondent Dominic Hughes is outside Arrow Park Hospital now. It's going to be a long journey for them when they finally leave Wuhan. What happens when they get there?
Well, those 150 patients, people, Sophie, who will be travelling here to Arrow Park Hospital in the Wirral in northwest England from RAF Brize Norton. They'll be accompanied by public health officials on that journey. But why are they coming here? Well, I think the truth of it is this has all been arranged very much at the last minute. This is somewhere that had enough accommodation to house those 150 people for 14 days. And of course, while they're here, should they need it, they will be cared for and monitored by doctors and nurses who work here at Arrow Park Hospital. But there's lots of things we don't know. While they're here, will they be kept isolated in their own individual rooms, or will they be treated as one big group? Will they be able to socialise together? Will they eat together? What happens if one of them falls ill during that period? What happens to the rest of them? So lots of things we don't know the answers to. But one thought about that raising of the threat level from low to moderate by the chief medical officers of the UK. They say it's not so much the threat to individuals has changed, but that the government needs to be prepared for all eventualities. Back to you.
Dominic Hughes, thank you.